Thanks, Linda, for that welcome back. And Linda's given me probably one of the biggest challenges I've ever had, because this is normally something we take like 2.5 days to teach people about HACCP, right? Raise your hand down in the reactions if you've ever taken a HACCP class. And we're just going to give you a little potpourri, basically, for if we're looking through the lens of, okay, we're going to treat agricultural water. From the perspective of food safety, when it comes to trying to learn from the past, HACCP is a really great place to start to try and build robust systems. And so it was kind of the approach that we took. It doesn't mean it's the only approach, but it's really, if you wanted to be able to endure some scrutiny and to have some backup for why you're doing what you're doing and how you knew it was effective, then this would probably be your best game plan, right? So let's get into some of these details. So really briefly, we're going to be using this framework of, if you've ever, again, taken a HACCP class, you're going to recognize it immediately. And if not, take a HACCP class. It's great. So and it'll give you a really good perspective on how to build food safety systems. So just really briefly, we're going to go into starting off with validation. That basically is what you're actually doing effective for managing the risk you're trying to manage. You've decided if a foodborne pathogen or an organism of public health importance is going to potentially be in your water, and you're not going to know about it, right? And therefore, if you decided you need to take care of that organism, how is your treatment actually going to be shown to be effective? Using it the way you use the water. This is a really tough one to get started with for most people. And it's the first step when you try and bring something on farm. So people stumble over it a lot, and we'll touch most on that. We'll go into monitoring, which I think most of you on the call either have experience with supporting people at their monitoring of food safety related activities, or are doing it yourself. We'll go into verification, which a lot of times does get confused with validation. We'll sort it out for you in the next slide, and then finish up with everybody's favorite, which is records. So with validation and verification, people confuse these all the time. So don't feel bad if you are stumbling, and kind of don't really understand what the difference is. From my perspective, validation really asks if what you're doing is actually effective. So ultimately, are you doing the right thing? If I told you to cook your hamburger to, 120, it's not, you're cooking a hamburger, but it's probably not going to be very effective at managing food safety risks. So the same thing is what we're trying to do here with pre-harvest water treatment. Verification, on the other hand, asks, are you really implementing the system the way that you've decided it needs to be implemented? So are you actually doing what you said you were going to do? I'm going to start with validation. And I would say, validation, and you're really lucky to have Linda as a resource, because she teaches whole workshops on nothing but process validation. So she can definitely give you some great perspectives there. But I always see validation as a two-step process. And you're going to need to know about both steps, but one step ultimately a farm is going to be responsible for actually implementing. So let's go through these two different steps. The first step is really trying to establish a scientific basis for why this treatment is going to be effective for our purposes. So you're going to have these studies that are either from scientific literature. Many times your technical trade associations may sponsor research or support research, or help aggregate data together from the literature to help basically prove the scientific basis if something is really important for a certain commodity. But what we're trying to do, and I would say the last thing is, with this EPA label, if companies start to adopt it that are in the antimicrobial pesticide product, the chemical category, then we're really going to begin to see, at least you're getting a 3 log reduction based upon the challenges that were presented in that testing protocol. So that's another example where you may even have regulatory frameworks coming in to support this. But you really want some data to prove that it's going to inactivate the organisms you're concerned with. Notice in that EPA testing method that we're just really looking at bacteria. If all of a sudden you have a protozoan parasite, what you're thinking you may need to control for, well, then you can't just say, well, if it works for E. coli, surely it'll work for Cyclospora, because that's not the case, right? And so we really need to be very specific and know about exactly what hazards we're trying to control for in general. And usually that's through historical association. I would say as scientists, a lot of this is what we spend our time doing. And really, when we're trying to do this, we're trying to design a process for the most resistant organism to that treatment that we expect to encounter. There's actually a risk within that input. So that's normally the approach that we take. So that's step one. That is information you will want to see whenever you're adopting anything. Step two is really on farm. How can I implement this treatment, and can I implement it effectively? We all know that even with a lot of rigor implemented in a validation study, ultimately, even within one ranch between different locations, right, you can have completely different canal systems, completely different challenges when it comes to treating that water. So really looking at within a location, how do I know that my treatment is effective? And how do I collect data to show that my treatment's effective? And really the question you should be asking yourself is, can you actually implement the system correctly? And do you get similar results based upon the organisms that you have at your disposal to kind of monitor and to evaluate? So let's get into a little bit of what that looks like. So again, I've already mentioned that this first step is really looking at what studies have been done, looking at specifically pre-harvest water, and really trying to figure out what levels do you have to treat at, right? Because our goal should be to look at this literature and say, okay, and this is purely as an example's sake, I know that I need 5 parts per million free chlorine. That is what my study says. That's what we should be looking to basically get as an output if I was in your shoes of actually trying to implement something on farm. Again, know that a lot of these studies may be supported by a manufacturer or supplier because essentially they're trying to get their product utilized by the industry. Of course, look out for those new EPA labels for the things that fall under those antimicrobial pesticide or chemical products. But know that if you're using a device like a UV light, you're also should be asking that supplier for the peer-reviewed studies to show that their equipment will actually perform and control for the organisms of concern that you're interested in. The second step we'll spend a little bit more time talking about, and that's really looking at how do I actually know that a system's working. When we first introduced, like the produce safety rules finalized, subpart E was finalized way back when, a lot of the growers started to look at the language. They're like, I don't know if I'll ever be able to develop a microbial water quality profile. I think I'm just going to treat my water all the time and not have to wrestle with this. And what I would say is you're still probably going to be doing water testing. Especially that would be my recommendation. The validation piece that comes on farm, as Shannon already mentioned, is really looking at how does chlorine, and I'm just using chlorine as an example here, how does that compound disperse throughout your system if you're chemigating? Because it is going to be a gradient across time. What's the worst case scenario? What's the treatment time at the first sprinkler head? What's the longest time? Where are your standards for water treatment at? What specifically should you be monitoring for? We're not expecting you to have salmonella and Shiga toxigenic E. coli in your water at levels that you're going to be able to measure easily. So what do we need to actually look for other than just these chemical concentrations? I would say doing this, what I would say mapping process for a chemigation treatment is really going to help you understand when you make an adjustment, just like Shan was talking about, what is that lag time between adjustment and you actually seeing that water reach, your most distal points throughout the system. What does purging look like, right? And it's going to be different for every type of set. We use a lot of center pivots here, which are a totally different ball of wax than a piped set system. Another piece of this is going to be water testing. Again, when you're in validation mode, you're really trying to show, I know if I treat at this level, I'm in the zones, and most traditionally we're going to be using either total coliforms, which are always present in higher numbers, or generic E. coli, which are a subset within the total coliform family. Now, why total coliforms? It's really because they are present at higher numbers. So if you took a sample in untreated water, then you had the most dynamic range for monitoring and activation. The way that we would do this is that we would actually collect our water. We would have a compound like sodium thiosulfate, which you may regularly get from your testing lab. Otherwise, ask them for it and they'll be able to provide a sample bottle with that. That will neutralize the sanitizer once that water is collected. And then you'll be able to basically send those tests off and have them evaluated for populations of these indicators. The way that we would actually do that is, I'm going to show an example on the next slide. So let's say, just for an example, we had in our untreated water 324 E. coli, and in our treated water we had 10.5. Most of these are MPN, so you can get half numbers and everything in between if you've ever seen that data. So what we would do is we would take the difference between our untreated and our treated water, divide by our untreated water, and these are pure populations, not log transformed, and then multiply by 100. So 324 minus 10.5 divided by 324, and then multiply by 100 to get it in a percentage would be 96.75% reduction in E. coli. Again, a lot of times, in my area out here, we may have E. coli counts and, 10 to nil. So really looking at this bigger group of total coliforms, which we also get back with many of our testing methodologies, that information as well, gives us, again, that larger population, a bigger dynamic range. So we can actually show, yep, I'm reducing total coliforms by this much percentage. For those of you, not to bore you with all our food micro talk, but, 1 log reduction is a 90% reduction, a 2 log reduction is a 99% reduction. So that is kind of the way that this shapes out, if you've ever heard people use those terms in the past. Now I'm going to shift into monitoring. After you go through a phase of actually validating your system, you're then going to be tasked with, okay, I've shown that I can implement the system. I know how I need to go about operating the system. I have all that data in hand. Now I can shift into actually just normal operating procedures. As part of this, of course, you're going to have standard operating procedures in place. As part of this, you're going to be doing monitoring events. And here's our CAN definition for monitoring, which is conducting a planned sequence of observations or measurements to assess whether a process point or procedure is under control to produce an accurate record for future use and verification. So again, without adequate monitoring, there's no real way for you to know or even to prove to other parties if your critical limits are being met. I've also thrown in a term, critical limits, here, which in Hapspolite is basically going to be those thresholds that you have to hit if you're aiming to achieve your food safety goals of inactivating the target foodborne pathogens that you want to inactivate at the levels you want to inactivate. So why do we monitor? We know that none of these systems are static. They're always changing. So the real purpose of monitoring is to track the operation of the process, to identify trends. When do you get out of control, if any at all? how stable is the system over time? I identify, most importantly, when there's a loss of control. When is the PAA, not getting to our most distal point, if that is one of our objectives. And it also helps you provide written documentation that the process is in control. So through your records that you will maintain as part of your monitoring events. Again, when a third party is in, they can only see what you're doing that one day. So of course, it's really important for them to be able to review these records and know what you've been doing all the other days that they haven't been present. Monitoring ultimately should help you determine if the control measures are being taken to manage risk. I would say many of the people we work with are actually the ones wearing the management role and trying to manage risk on the farm. And they're being asked, other people basically to implement these systems at various locations. So it also, basically allows you to collect that data and to review at different locations to make sure you feel confident that those systems are being effectively implemented. And of course, when we're thinking about monitoring, it's really going to help us outline what exactly are we doing during monitoring, how do we go about monitoring, what frequency are we going to monitor at, and who should actually be doing the monitoring. So really, really high level. What are we monitoring? It should be a measurement or an observation. And again, going back to that term that I introduced earlier, it really should be based around, okay, am I getting my PAA residual at the critical limit that my validation studies say I need to achieve? The examples would include of things I could monitor, could be time, again, a concentration of any of these antimicrobial pesticide products, potentially temperature. Some of our antimicrobial pesticides, such as chlorine, are really impacted by pH, and we see a lot of slightly alkaline water sources in our growing region. So knowing that is really important. And then also UV intensity to throw in something that's tied to a device. As far as how, it's going to be what's the actual measurement that we take. We want these to be quantitative so that it's a reading that you're taking and you write down the results. Again, if we have to, we can do a qualitative or an observation-based monitoring event, but you do have more of a wiggle room, right? Because you're relying upon people ultimately to do that qualitative assessment. So training is always key, but it's even more important for consistency here. For any monitoring event, the most important thing is it needs to be real-time and accurate. So getting a water test result back is not going to fall in this category, right? Because we know it takes several days to get those results back, and we need to know, yes, no, from moment to moment, are we in or out of compliance? For frequency, I would say we love to get continuous data for monitoring. In some systems, Shanna showed that, the grower who is using free chlorine measurements, that's totally achievable. Other times it's not, in which case we'll do a non-continuous monitoring with like test strips or titration kits or something along those lines. So this is where the validation use study you do on farm is you should be implementing basically outputs from that study to say, okay, we think our system's pretty stable. This is why we've established this frequency to our monitoring events. And then finally, who's going to monitor? The most important thing is that whoever's going to be monitoring be really well trained. And I would even try and get them training beyond just doing the actual event. Let them understand how important this is to your food safety system as a whole. This is just going to give us a really high level overview of corrective actions. Again, whenever we're monitoring something, you're going to go outside of what you would hope to achieve, right? So we have this limit up here. It's called our operational limit that's slightly above our critical limit. We're monitoring and we're taking down these free chlorine readings in this case. And then right here, we have a dip below our critical limit. In this case, we do have a corrective action that's required because we haven't achieved our goal of maintaining at least 2 parts per million free chlorine, which by the way is totally just used as an example's sake. So what is a corrective action? Well, those are our procedures that we follow when a critical limit isn't met. Ultimately, corrective actions, first and foremost, should fix and correct the issue of noncompliance. So increase the rate of chlorine that's being injected would be an example. Again, you're going to have records that show your noncompliance and what you did to correct it. And then lastly, determine if there are any special actions that need to be taken for any product that was exposed to untreated water. For verification, this is one of our last kind of segments before record keeping. That's really these activities other than monitoring that really help you establish that you're doing what you said you were going to do at the end of the day. The things that fall under the verification umbrella are calibration of monitoring devices. So thermometers, pH meters, ORP meters, free chlorine meters is the example that Shanna showed are all examples. Review of calibration records. So you actually get the record back from where something's been calibrated and you sign off on it to show that you've seen that information as someone in management. And then finally, record review from our monitoring events or corrective actions. The last one is targeted sampling and testing. Sometimes we may go through and do pool water tests, for instance, to show that we are hitting our metrics and that everything is running as we had expected. But always know that you cannot test your way to food safety, because we really expect a foodborne pathogen to hopefully be like a needle in a haystack. The likelihood of you finding it's pretty small. Records review is a cornerstone to verification. It really shows that management is dialed in and looking at how their systems are being implemented. Things are going to go askew and you need to correct them as soon as possible. So this records review event is going to be really key for you doing your job effectively. For record keeping, I would say essentially we're going to have our monitoring records, our corrective action records, our verification activities that we may be conducting. One of my favorite verification activities is a direct observation, where you're watching people when they're performing a monitoring event just to know that they're doing things appropriately. And again, ultimately, we also would have our studies to support to our validation studies to support our treatment methods. And then, of course, records of training. Here's our laundry list, and this is by no means anything novel that we would want to shoot for our monitoring records. Again, noting that we have our data review for somebody actually doing a verification procedure here. So I hope that you all have gotten a little bit out of this. Again, if you're a little lost, know that there's a ton more information that we could build out around this, and please take part in one of the Bridging the Gaps workshops coming up. But really, on-farm validation is essential, and that's something we really want to be communicating to the industry. You need to be able to monitor these agricultural water treatments and then keep these records so that we know that we're staying within our limits. And that is it. Thank you. Sorry